Feeding a rabbit with a syringe isn't something most people expect to do, but sometimes it becomes absolutely necessary. Whether your rabbit is sick, recovering from surgery, refusing to eat, or suffering from dental problems, syringe feeding can be the difference between life and death. In this video, we'll walk you through how to do it safely, gently, and effectively. First, let's talk about when syringe feeding is needed. A healthy rabbit should be eating constantly, nibbling hay, drinking water, and producing regular, round droppings. If your rabbit suddenly stops eating or pooping, even for 10 to 12 hours, that's a red flag. Rabbits have a very sensitive digestive system. If food stops moving through their gut, it can lead to a condition called GI stasis, which is extremely dangerous. In cases like this, if the rabbit isn't eating on their own, you'll need to intervene. A vet should always be your first stop. They can rule out serious conditions, give fluids, and prescribe medication. But even after that, at home, you may need to help the rabbit recover by syringe feeding. Let's get into the basics of how to do it. What do you need? You'll need a feeding syringe, preferably one with a soft tip and wide opening. You can get these from a vet or pet store. You'll also need a critical care formula made for rabbits. This is a powdered mix, often based on hay, that provides essential nutrients and fiber. If you don't have access to that, a temporary homemade blend can be made with soap pellets and a bit of warm water. But critical care formulas are the gold standard. Next, make the mix. Combine the powder or soap pellets with warm water until you get a smooth, slightly thick paste that can pass through the syringe without clogging. You want to be soft enough to push, but not so watery that it spills everywhere. Now, position your rabbit. Place them on a non-slip surface like a towel on your lap or a flat table. Some rabbits may tolerate being wrapped in a towel, a technique called a bunny burrito, to prevent them from kicking or wriggling. The goal is to make them feel secure, not trapped. Once the rabbit is calm, take your syringe and gently insert it into the side of their mouth, just behind the front teeth, where there's a small gap before the molars. That's the safest spot. Never push the syringe straight from the front or too deep into the throat. You risk choking or aspiration, which can be fatal. Push a small amount of food, just a tiny squeeze, and allow your rabbit to chew and swallow. Be patient. It might take a while. Rabbits don't gulp down food the way dogs or cats do. They need time. Continue this slow process until you've delivered the recommended amount of food for your rabbit's weight and condition. This might be several syringes worth. Spread over a few feedings during the day. It's also important to offer water through a separate syringe if the rabbit isn't drinking on its own. Dehydration only worsens stasis. Small, frequent sips of water can help, but again, don't force it. After each session, clean your syringe thoroughly with warm water. Never leave old food in the syringe, as it can clog, grow bacteria, and harm your rabbit. As your rabbit begins to recover, keep monitoring for signs of improvement. More activity, interest in hay, and normal droppings. Once they start eating on their own, you can begin to reduce syringe feeding slowly, always under the advice of your vet. Syringe feeding a rabbit takes patience, gentleness, and care. It's not easy at first. Your rabbit might resist, turn away, or try to escape, but your calm presence and consistency will help them through. It's not just about getting food in. It's about helping them feel safe enough to heal. Remember, never delay if your rabbit stops eating. The earlier you act, the better the chances of a full recovery. And if you're ever unsure, always reach out to a rabbit-savvy vet.